Hello everybody, welcome back. Today I thought we'll have a look at some stuff for a dental extraction, which is a pretty common little job in the dental industry. So let's have a bit of a gander at what I've got out. Okay, so over here, let's have a look. So I'm going to introduce you to some instruments we have in front of us today. We have our luxators and our forceps. So this would be for very simple extraction, not a surgical extraction. That's something a bit different. Again, that's got a few other instruments that go along with it. So today we're just going to focus on a simple extraction. Okay, so we've got our luxators, as I said. So our luxators are in our bag here. They're sterilized with our batch code. There are two different kinds of luxators you need to have out. So we've got a wide luxator. You can see the paddle on that one. And a narrow luxator, which you can see the paddle on that one's a lot narrower. So a wide and narrow luxator. Sometimes they're bagged separately. Ours we like to do together. So yeah, probably just check depending on what your practice has. Moving on, these are the forceps. So the forceps are what we use to remove the teeth. So we've got an upper forcep and a lower forcep. These are the upper molar forceps, and I had this really great dental nurse teach me something when I was just starting. It's called cheeky beaky. So you can see here on the top, this is a molar forcep. On the top here, it has a little bit of a beak. So if we turn this around, cheeky beaky. So whatever side this is for, the beak goes to the cheek. So this will be your left-hand side molar. The beak will be on the opposite side, and when you hold it up, the beak will be to the outside of where the cheek is. So beaky, cheeky, and thanks, Galen. So we're looking over here now. We've got our lower forceps. So you'll notice the upper is pointing up and the lower forcep is pointing down. So this is a lower central or premolar forcep. As you can see, there's no beaks on this one, whereas the molars, they all have beaks. So just checking, there's a bunch of different forceps. So you just need to have a look at which is upper, which is the lower. It takes a little while to learn, and it doesn't hurt if you can get them written on the bag as well when you're learning. But yeah, there's a whole different type of forceps that you can use in the mouth. Moving over, so we've looked at our forceps. Let's have a look at some other things. We always have our gauze out. So this is non-sterile gauze. You use that to wipe the dentist's mirror or to wipe an instrument. You can have yours to wipe the patient should there be any debris. We also have over here, this is the sterile gauze. So non-sterile, sterile gauze. Easy to know because you make it, and also it's in our bag. So I've got two out here. One is for us to use in surgery. This other one here is for patient take home. So with these, they're bound up. I like to open it when it's required, not prior to, because then it's exposed to aerosols. So I like to have one of these when the dentist has extracted the unit or states that he wants the gauze. I take some out. I actually use a little bit of antiseptic. I've not put it in the cup because I don't want to waste the cup, but I put a little bit of antiseptic mouthwash and grab one of these, make sure I've got gloves on, and pop it into the cup, let it sop up a little bit, and then pop that into the socket. It just helps clean the area. So I do that, as in the nurse does that. The dentist will be typing his notes. I sort of wait 5 minutes. Then I change the gauze. I just tell the patient that I'm going to change the dressing, take it out, make sure that it's clotting well, and then put another fresh gauze into the site. So during this time, it's a great opportunity to go over the post-operative instructions once the tooth has been removed and you're changing the gauze. So we have a take-home post-operative instruction sheet that I actually give to the patients, and I give them their take-home gauze. I like to put this in a bag, also throw in a magnet and a toothpaste for them to take home, and also if the dentist has given them a prescription. So I go over the post-operative instructions with them. So my post-operative instructions, I sort of just say, So have you had a tooth taken out at the dentist before? Yes, no. It doesn't really change what I say. I just say, okay, so remembering soft, nutritious foods, soups, custards, yogurts, things like this are really good. Taking it easy for the rest of the day. Avoid heavy lifting. Are you going back to work? Does your job involve you to do heavy lifting? Pain medication, 2 Panadol, 2 Nurofen, unless you've got any allergies. If the doctor's given you a prescription, make sure you get that taken care of. By day 3 to 4, you should be getting better, not worse. So if you develop a fever or any kind of sick feeling or funny taste in the mouth from the site, make sure you give us a call. It's normal for the site to weep. There shouldn't be copious amounts of fluid though, so make sure you give us a call if that happens. We always give our patients a follow-up phone call as well, 24, worst case 48 hours if it's really busy, 24 hours being if it was a pretty tricky exo, 48 hours if it's more of a simple one. So yeah, we always follow up with our patients and make sure that they're okay. Try to be really understanding as well when your patient comes in for an exo. They're usually really nervous, so it's sort of your job to make sure that they're nice and calm. But yeah, so that's sort of what we have out for our extractions. Might be different, might be the same where you are. So let's have a goings over again before we go. So we've got our luxators, a wide and narrow. We've got our forceps, upper molar, lower. We've got our gauze for us to use. We've got our non-sterile gauze, sterile, non-sterile. We've got our patient's gauze pack and our patient's take-home instructions. Most practices have that. If not, why not do that? But yeah, so hopefully this turns out well and you like it. Otherwise, I will say happy nursing, happy assisting, and I will see you next time. Have a good day.